I'm Pat Osterman.
And I'm Dr. Jeff Sparks.
Well, the calendar has turned to November, so that means another edition of No Shave November. So we appreciate everyone who followed along last year, and as you can see from our faces, we're already off to a pretty good start in 2019.
And my wife loves it.
And to mix things up a little bit, this year we want to take a little different approach. We want to talk about cancer awareness. So Dr. Sparks, talking about the skin and throat cancer, so as an ear, nose, and throat specialist, you pretty much cover everything from the collarbone up.
Pretty much. So we don't do anything with the brain and we don't do anything with the spine. But outside of that, so any skin cancers, any lumps and bumps that you have above the collarbone, certainly get them checked out. Anything that persists more than 2 weeks, you should have somebody look at.
Typical treatment process if somebody wants to come in and talk to you about something they may be concerned about.
So anything on the skin would come in here, and this is actually the procedure room where we take care of it. A lot of times we do biopsies here in the office, then we can actually excise it here in the office depending on what kind of cancer it is. Some of the cancers that are more extensive we do take to the hospital. If you have lymph nodes or neck masses, anything like that, we would biopsy here in the office, but then we would take you to the hospital to have surgical treatment.
So if Dr. Sparks, if somebody has a concern and they want to come see you, is there a typical timeline, or how many visits does it usually take for diagnosis and treatment?
So most of the time we can get it diagnosed within 1 or 2 visits. So we can do biopsies here in the office most of the time. Occasionally we have to go to the hospital for a biopsy, and then we can get a diagnosis and then treatment plan based off of that.
So as we get ready to approach the winter season, and since we're in here talking with ear, nose, and throat specialist Dr. Jeff Sparks, let's talk sinus quick.
Okay.
Because I know that's another area that you deal a lot with, especially with the winter months coming up.
Absolutely. So we just got through fall allergy season, and so a lot of people are struggling with that. And now we're getting into that time of year where you got to wash your hands and really avoid getting exposed more than you have to. So sinus rinses are great, but certainly if you get more sinus infections, more than 1 to 2 a year, then you need to be evaluated. And more than 4 infections in a year is typically a criteria to get sinus surgery.
And that's something that you can, again, do right here in your office.
There are times where we can do balloon sinuplasty right here in this room, and other times we take people to the hospital.
All right. Well, again, make sure you follow along throughout the month of November. We'll be bringing you different updates, and I'm sure we'll have Dr. Sparks on again at some point. Again, beard's looking pretty good, Dr. Sparks.
All right.
So for Dr. Jeff Sparks, I'm Pat Osterman. Thanks for watching.
Have a great day.